I absolutely love what I do as a GP on a daily basis. I meet all of you. I see all of you sometimes when I'm out and about in the city. And it's wonderful to come here every Wednesday and just talk to you about simple things. Some are quite complicated. Some are a little bit taboo-like and controversial. But it's a way to connect to our community. And as well as that, we have a whole team behind us in the way of the Salaam radio management. And we're all volunteers trying to bring the best to you in community radio. So thank you very much for being here. I wonder how you've all been. This weather is really miserable at the moment, but it's going to hotten up towards the end of the week. And I really hope that you're going to be prepared. So make sure that you keep yourself hydrated, away from the heat, and drink plenty of fluids. Wear your sun cream, protect yourself from the ultraviolet rays, make sure that you wear sun hats. And it's due to be on the weekend, but I'm hoping that many of you can celebrate with having some healthy barbecues and also enjoying time with your loved ones, which is very important. As you know, it's very important to take out time for yourself as well. So we've got one wonderful show packed up, lined up over here today on the Body Health and Mind show. And I've got a very special guest, but what I would love you to do is to participate by texting and WhatsApping us on 07745 278 978, or you could ring us on the studio telephone number 01733 602 133. We are on Facebook Live, we're also on YouTube Live, we're on Instagram Live, and we're on Twitter Live. So this is the amount of outlets that you have to be able to listen to our show. So there is no excuse for missing this show because it's going to be a wonderful one. So before I crack on, I like to give shout outs every week to somebody special. And today, actually, I'm going to give a shout out to my very special husband. I don't know if he's listening. He probably will be. And my husband happens to be one of the consultant ear, nose, throat surgeons at the Peterborough City Hospital. And he was awarded his Certificate of Excellence today. So I'd all like you to join me in congratulating him. I'm very proud of him. We all are very proud of him. He's a wonderful clinician who looks after his patients. So please all join me in praying for him, that Allah subhanahu wa ta'ala grants him more barakah in the work that he does. So without further ado, let me introduce you to our very special guests. So I have here present with me on the radio is Dr. Mohammed Ahsan Saleem, F.R.C.R. He's a consultant radiologist in breast and clinical radiology with the University Hospital of North Tees in Hartlepool. His accolades are: he's an M.B.B.S. from Allama Iqbal Medical College in Lahore, a Diploma in Advanced Surgical Sciences from the University of Edinburgh and the Royal College of Surgeons, Edinburgh, F.R.C.R. from the Royal College of Radiologists in London. He's also a member of the European Society of Breast Imaging and British Society of British Breast Radiology. And today we're going to be discussing breast cancer screening, which is very important, alongside its role in diagnosis breast cancers, further treatment, and the importance of screening. And let's all welcome Dr. Mohammed Ahsan Saleem. Assalamu alaikum.
Wa alaikum salam, Dr. Shabina. Thank you for the introduction.
Not at all, but we are very familiar with each other, aren't we? Yes, we are. Now, I've got to give my listeners a background about you a little bit. Now, Dr. Ahsan Saleem and ourselves as families, we go back a very, very long way, mashallah. And it's through, obviously, my husband, Asad, and they trained together in Edinburgh Hospital, and then I think we went our own little ways, and we met in Turkey last year. And Dr. Ahsan Saleem, I'm sure that you won't mind me divulging, you're a very keen traveller as well, mashallah. Yes. And we're very, very good family friends as well. So it's an absolute delight to have you here today, Ahsan Bhai. And how are things with you?
Thank you. Things are fine, alhamdulillah. Things are going fine. Kids are in school. Looking forward to holidays.
Yes, I'm sure we are all looking forward to the holidays. It's very much needed, isn't it?
It is.
So, Ahsan Bhai, would you like to tell us a little bit about what your line of work is? And why did you actually choose this field of breast screening and diagnostic breast imaging, as it's called?
When I was joined radiology, with a lot of people have this perception that radiology is just looking at the X-rays, CT scans, and MRIs, and we don't have any direct vision contact. It was until my module
of
of breast
radiology when I was
radiology
training,
when I
when I
actually had my own
had my
clinic
own
where I
clinic
can
where
see
I
the
can see the
patients, I
patients,
can,
I can,
talk to them,
talk to
I
them,
can
I
examine
can
them, I
examine
can do a
them, I can do
scan,
a
I can
scan,
do
I can do
simple
simple
procedures like
procedures
taking a
like taking a
sample if
sample
needed.
if needed.
Sure.
So all
So
those
all
things,
those
and
things,
then
and then
the other
the
element
other
is
element
again
is again
breaking the bad
breaking the
news
bad news
or
or
communication with your
communication with your
patients, their
patients,
families.
their families.
So that bit
So
of
that bit of
radiology really
radiology really
fascinated me
fascinated
because
me because
I was not
I
only
was
looking
not
at the
only looking at the
images, but I was
images, but I
also
was also
explaining them to my
explaining them to my
patients and
patients and
making a
making a
difference
difference
to their
to their
lives,
lives,
progress.
progress.
And breast
And breast
radiology,
radiology,
again,
again,
breast cancer
breast cancer
is one of the
is
most
one of the
common
most common
cancers, as we
cancers,
know, in the
as we know in the
females.
females.
And every
And
one in
every one
eight
in eight
females would
females
have
would
this
have
cancer
this cancer
at any
at
stage of
any
their
stage of
life.
their life.
So I think
So
that
I
was the
think that
main
was the
thing.
main
And
thing. And
taking it
taking it
further, obviously,
further,
I've been to
obviously, I've been to
Pakistan. I've been
Pakistan. I've been
doing some
doing some
workshops in
workshops in
Pakistan,
Pakistan,
just to
just
create
to create
awareness, and
awareness, and
not only for the
not only
doctors
for the
but for the
doctors but for the
local people as
local
well,
people as
to
well,
create the
to create
awareness
the
about
awareness about
this
this
disease.
disease.
It is, and I think it's wonderful that it's an area where not enough importance can be stressed, may I choose to add, especially in the country of Pakistan, a developing country. Obviously, there's a dire need for improvement of facilities, especially in the diagnosis of cancer such as breast cancer. And like Dr. Ahsan has said, that breast cancer is the most, actually in the UK, it is the most common cancer, and about 150 cases are diagnosed every day. And I was recently involved in the breast cancer screening program that was delivered on behalf of the British Islamic Medical Association. And one thing that we learnt from that was that there are 11,400 breast cancer deaths in the UK every year, which is staggering, isn't it?
It is indeed.
It is indeed. And
if you look at the
if you look
scale,
at the
it's not only
scale,
the
it's
death
not only the death
of that
of
patient,
that patient,
because there are the lives
there
of
are the
other
lives
people
of other
attached to
people
that
attached to
patient.
that patient.
So she can
So
be
she
mother,
can
she
be
can be
mother, she can
sister,
be
she can
sister,
be a
she can
daughter.
be a daughter.
Yeah.
We have
We
seen
have seen cases
where
where
the cancer
the
runs in the
cancer runs
family.
in the family.
So that's
So
why
that's
we
why we
stress that
stress
screening is very
screening is very
important.
important.
Yeah.
And
And one,
if you come to
if you
screening
come to
age, then you
screening age,
must
you must
attend
attend
the screening.
the screening.
Just to
Just
take the
to
back
take the
further,
back further,
what we have
what we
noticed
have noticed
that
that
ladies from
ladies from
ethnic minority
ethnic
groups
minority groups
are quite
are
reluctant
quite
to attend
reluctant
these
to attend
screening
these screening
clinics,
clinics,
and when they
and
should
when
be,
they
because
should be,
it's
because it's
completely free of
completely free
cost.
of cost.
Yeah.
All it's
All it
required
is
is you have
required
to
is you
go
have to go
and attend
and
the
attend
screening.
the screening,
Mammogram work,
mammogram work,
the
and the
clinic
clinic
they have for
they
you.
have for you.
Um, the
The
incidence of
incidence of
breast cancer,
breast cancer,
be it ethnic
be it ethnic
minorities, all
minorities,
local
all local
people,
people,
local
local
population, white
population, white
population is the
population
same.
is the same.
So that's
So
why we
that's why we
stress that we
stress
have
that
to
we have to
um, make sure that
make
we
sure that
all the
all
ladies
the
who come
ladies
to
who
the
come
age
to
of
the age
screening
of
must
screening
attend,
must attend.
because
Because
earlier we catch
earlier
it,
we
the
catch it,
easier the
the easier
treatment
the
is.
treatment is.
Yeah.
So that's the
That's
whole
the
point of
whole
screening
point of
breast
screening
cancer.
breast cancer.
Yeah, and I'd like to actually, I think that it's so important, especially thinking about our listenership at this moment in time, that we very rightly speak about ethnic minorities, especially South Asian women and Asian ladies who aren't, they have a very low uptake. And actually, we have a national average where I think 80% really should be the target nationally. And in Peterborough, I can speak of the statistics here, I'm not sure what it's like elsewhere, but in Peterborough, we are actually below target on screening with breast cancer, or breast screening as it is. And I think that that's very concerning. And that's why shows like this are really important to create that awareness. And Dr. Ahsan, is there a reason why women from ethnic minorities don't go for screening? Have we identified anything?
I think there
there
are
are certain
reasons which we
reasons which
think
we
of.
think of. We have
Looked in our
looked in our
local
local
population is,
population is
first of all, there's a
there's
communication gap,
communication gap,
and then
and
to raise
then to raise
awareness as well.
awareness as well.
Because
Because
when we live in
when we
our
live in our
societies, obviously,
societies, obviously,
our
our
ladies, they
ladies
tend to
they
go to
tend to go to the
our local
our local
GPs and stuff.
GPs
But
and stuff. But
any
any
workshops we
workshops
arrange
we
locally
arrange locally for the
for
people, for
all the
all
population
the
to come and
population to
attend
come and
to
attend to
raise awareness
raise
for
awareness
screening,
for
be it
screening, be it
breast cancer or
breast
any
cancer
other
or any
cancer
other
screening.
cancer screening.
We find
We
that
find that
the ladies
the
from
ladies
ethnic
from ethnic
minority, or
minority, or
as for
as
the
for the
males as well, they tend not to attend it, and they just want. There's a communication gap in between, and which causes the main, I think, main hindrance. The other thing is there is a myth about it that it's a cancer, or there's a fear that if it gets diagnosed then it will be the end. Well, it's not like that. With breast cancer screening, the mortality has reduced significantly since the program was introduced in 1987. And nowadays we can actually diagnose cancers which are about 3 or 4 millimeter, and ladies can be treated on the same day. Wow. So they come on the day of surgery, they have their surgery, they go home in the afternoon, in the evening. So it's a day procedure nowadays. So again, as I said earlier, we catch it earlier, and the in best possible way we can treat it.
Yeah, and I think that's absolutely right, what you're saying in terms of it's creating awareness. You gave some really important information. I'd like to, again, repeat that with the listeners, that Dr. Saleem had just said that some women, obviously there's a communication gap, especially with women from ethnic minorities, and that technology is so advanced nowadays that we can even detect breast cancers up to about 3 to 4 millimeters, which is teeny tiny. It's less than half a centimeter. And if they are detected, then those ladies can be treated on the same way. They can undergo surgery and they can go home. So, and it's all free on the NHS. We're so privileged to have the NHS, and this is something that we can't stress about enough. That when this is all free, we should be availing it. And do you think, Dr. Saleem, something that's just come up in my mind actually, that do you think that the aspect, especially with ethnic minorities, especially with South Asian and Muslim community more so, do you think that there is the perception that women, because it's an area of their body that they don't like to expose naturally, that they may be examined by males? And is there the option of them requesting a female sonographer? And it's exclusively really more or less females, aren't there, in such departments?
Yes, I mean, so the breast cancer, I'm working as a radiologist, but wherever a lady prefers that she wants to be seen by a female consultant or female practitioners, we always try to make sure that we do have that available. We do have female consultants as well working with us. However, very rarely, if someone is on leave, then I think it's 1 in 100 times there might have to be seen by a male consultant. But otherwise, most of the time we do make sure that you get seen by a female consultant, have female chaperones in the clinic as well. So we make sure that all ladies who don't want to see a male consultant get seen by the team, the whole.
Okay, well that's wonderful to know. Yeah. And if you've just joined us and tuned in, it'd be wonderful to have your company. We have Dr. Mohammed Ehsan Saleem, who's a consultant radiologist in breast and clinical radiology at the University Hospital of North Tees in Hartlepool, and we are talking about breast cancer screening at the moment and its relevance. And Dr. Saleem, when we talk about screening, could you tell our listenership a little bit about the ages that screening should be taking place and what we need to do thereafter?
So the breast cancer screening was obviously first introduced in UK in the whole world 1987. And at that time, the screening age was 50, going up to 70 years of age.
Okay.
Now at the moment, we have a new trial which is called age X, which means we are going 3 years before 50, so from 47 and extending it to 3 years.
Wow.
Now every lady gets a call when they reach their 47. They might get the first one on 47, or when they are 50, they will get a letter, and up to 73 years of age. When you reach 70 or 73, if you don't get any letter, you can still recruit yourself. You don't have to do anything. You just have to give a call to the screening center, and they will arrange a mammogram for you.
Wow.
Now there are certain variations in different countries: Canada, America, Norway, Scandinavian countries. They do it separately. But in UK, we do it every 3 years. Other countries do it every 2 years or 18 months. Now, as much as we talk about screening, the ladies which are below 47, For them, we do have one-stop clinic or symptomatic clinic. So if they have any symptoms in their breast, like pain, if they feel a lump, is there tenderness, any abnormal discharge, they can always refer themselves to the one-stop clinic. They can go to the GP, and we see all such patients on 2-week rule.
Right.
And our return is very good. So any patient who feels any symptoms, they can straight away go to the GP, and we get straight referred. So and the patient gets seen within 2 weeks as well.
Wow. And is there any way, when you say self-referral, does that has to go through their GP, or are they able to walk into the clinic themselves?
No? Some places can do walk-in, but I think most times it has to be from GP.
Sure.
But as for screening, yes, they can call the screening, for doing mammogram directly. You don't have to go through GP. Call the screening unit, get mammogram done.
Okay, well, that's amazing. So that's all under 2 weeks. So anybody that feels that they've got symptoms within the breast that they may feel could be to do with cancer, they're then referred. And are they then followed up by a breast surgeon, or what happens after that?
So again, it depends. The way one-stop and screening run, they're slightly different to each other. And again, different hospitals have different variations. When we see a patient, when we get a referral from the GP, we'll get a patient in. If they are above 35, we'll do a mammogram. If they are below 35, we'll do an ultrasound. And it's just to keep them safe from unnecessary radiations. And then once we have seen the patient in the clinic, we would have scanned them, we would have looked at mammograms. If everything is normal, we'll send them to surgeons who will finally have a look at the patient, examine the patient, and make a plan.
Right.
So symptomatic patients are followed up by the breast surgeons. In screening, again, if patient comes to us, again, if everything is normal, the patient goes home. However, we find that the patient has any cancer, or anything which is suspicious, then everything gets discussed in the multidisciplinary team meeting, which is attended by surgeons, oncologists, radiologists, breast care nurses. So as a team, the breast care nurses are their main point of contact, who look after them, who have everything. And then obviously once it is confirmed that they have a cancer, then they will get a named breast surgeon who will look after them.
Okay.
So it's more of a team effort, especially in breast screening. So there's a lot of help available for the breast screening.
Sure. And for purposes of our listeners, so they understand, would you please like to explain to them what is the difference between an ultrasound and a mammogram? Now, I thought they were the same, and this is somebody who's a medical professional, but I'm now speaking to an expert. So would you like to enlighten me and the listeners as well?
Okay. So mammogram, the easy way to define it, like you do chest X-ray of the chest. This is an X-ray of the breast. So mammogram is more of an X-ray where you have radiation involved, where you have radiation given to the breast, and it takes an image like an X-ray. Ultrasound, as most of ladies of childbearing age haven't had any kids, they would have ultrasound, the scan during pregnancy. Ultrasound is different. It doesn't have any radiation involved into it.
Sure.
So these both tools, they help us aid our diagnosis. So mammogram is good in screening purposes because it can show up any areas of concern. It doesn't have to be cancer. But any areas of concern, mammogram can show us, and we do an ultrasound of that particular area of the whole breast, and just confirm that anything suspicious we have seen on mammogram, is it definitely a lump? Is it a benign lump? Is it something suspicious? Or was it just normal breast tissue which slightly suspicious? So ultrasound, it's more of a more definitive or diagnostic. Mammogram is more of a screening tool.
More of a screening tool. So that takes me on to my next question. Because X-rays, like mammograms, have a certain amount of radiation exposure, which comes with its own small amount of risk, I would say. Why are we not implementing ultrasounds where the soft tissue enhancement would be more specific? What's the reason?
So the reason again, doing ultrasound first of all takes a longer time. So it has to again. If you have to screen 100 patients a day, that means we will doing ultrasound about 10 to 15 minutes to one breast. So if you are screening both breasts, 30 minutes at least to screen one patient. The mammogram takes about 2 to 3 minutes just to do the mammogram. And reading mammogram is much more quicker. So that's why we use that. And it's again As I said, doing an ultrasound will take longer time. So it's not cost effective. So that's why we use mammogram as an initial tool for screening.
Right, okay. So I hope, listeners, that has enhanced a little bit of your knowledge with regards to the difference between mammogram, which I found out today what it is, which is quite funny, isn't it? As a GP, they usually say that GPs don't know much, but there you go. I know little bits, but that's not my area of expertise. And when we talk about ultrasound scans as well, so mammogram is actually a specialist form of an X-ray that's done for the breast. Now, talking a little bit, it'd be good to touch on the fact that 78% of women survive breast cancer for 10 or more years if they undertake their screening, because there's a higher rate of detection, isn't there?
It is indeed. As I said earlier, the earlier we catch this cancer, the better are the chances of survival. Now, just to give an example, when I was in medical school in Pakistan, a lot of ladies presented when the breast cancer was quite advanced, where it's coming through the skin, or it has spread to the other parts of the body. In England, in last 8 years, I've only seen one or two cases of those cancers, because a lot of ladies do take up the screening program, and there is, especially in the local, there's quite a lot of awareness about it. So they do come in early and get treated early. So. Yes, any health, any cancer, there are screening programs one should attend those, because it helps you. Their programs are there for you. They are free for all the people living in the UK. So one should attend it.
Yeah, and it's very important. Now, just because we are talking about breast screening, it would be great if you could tell our listeners, especially about the signs and symptoms to look out for when we're talking about lumps or any breast masses at all. Would that be possible, please?
Yes, it is. So a lot of people think that breast pain is one of the signs of breast cancer, which it's not. Breast tenderness can it's probably one of the most I think weakest link with the breast cancer. The signs obviously we worry about when examining patient. If a patient has felt a lump, if there's any distortion in the shape of the breast tissue. If there's any thickening, if the skin becomes quite edematous, quite thickened, there's any blood stain discharge. So those are the main signs which we worry about. Pain on its own is not a sign of breast cancer.
Yeah.
So all those any change the shape, size, any thickness in the breast, any lumpiness, swelling, which is disproportionate to the other side, any blood stain discharge, those are the signs you have to look for the breast cancer.
Okay, so I hope that the listeners who have joined us, and we've got Dr. Mohammed Ahsan Saleem here, who's a consultant radiologist in breast radio diagnostic imaging, and you've heard a little bit about what the signs and symptoms could be of any breast cancer. So like you said, change in size, shape or feel of a breast, any new lump or thickening in the breast or the armpit, any fluid discharge or any discharge leaking from the breast, distortion of the breast, and skin changes as well that look like the surface of an orange peel. That's known as podi-orange appearance as well. So any dimpling of that or any rash. Now, pain, you very rightly said, isn't a sole sign or a symptom of breast cancer. However, would you suggest that any lady who has persistent breast pain should still be seen or screened or scanned? What are your thoughts in regards to this?
So any who is having breast pain, I think they should go and see their GP. And depending on their symptoms, GP will be able to refer them either to a breast surgeon or radiologist to do a scan. So what I'm trying to say is that breast pain is not a sole sign of breast cancer. How we need to look at it, because there could be other causes of breast pain. In some patients, this is associated with their menstrual cycle. We have what we call nostalgia, which again can be helped by the breast surgeons with certain medications. So yeah, please look after it. But it shouldn't be thought that it's a sign of breast cancer. I think that's the difference I was trying to.
Yeah, that's a good point that you've put that forward. Now, in the last 2 minutes that we've got, I've got a question here from our wonderful sponsor, Brother Bilal from Amar Food Store and Halal Meat. Assalamu alaikum, brother. He says, hi, great show as always and very informative. So he's asking, is it true the use of plastic-like bags and containers increase the chance of cancer? What would be your thoughts on this?
Again, I think at one time we used to have a black shopping bags and stuff like which might have had some influence, but nothing at the moment as such. I don't think that the bags we use at the moment cause any cancer. However, I think that the reason they are banning these plastic bags is second due to the general pollution which goes into the environment, the ecosystem. I think that's more to do with that and the effects it has on the animals and the population.
Yeah. So I hope that has conferred some understanding, Brother Bilal. Thank you very much, as always, for listening to my show. And we are now approaching a break. So, Dr. Saleem, hopefully you'll be able to join us back where we can talk a little bit about risk factors towards breast cancer and what to expect a patient that walks through the door, what they expect when screening takes place. So, thank you very much. And all of you who are here, just keep tuned in so we talk about this very important topic on breast screening and breast cancer. Thank you very much. See you after the break.
Thank you.
Stay tuned to Salaam Radio after this short ad break.
It doesn't take much to bring some difference. You give some change, which makes a change. Because nothing gets mileage like a charity. Just a little change turns into a chain. And before we know it, the results are massive. So give a little to make a big difference. For donations, call now. UKIM 0207 387 2157.
दोस्ता कियां परेशान है
जरा कर है ना सारा सौदा मुक्या वा मुल्का विच पैसे भेजने
हूं नहीं अमार फूड वाले की फोन खड़का ते फ्री लोकल डिलीवरी कार मंगवा
आला ता उथे क्या स्पेशल आ
उना की लबई हाइजीन च ग्रेड 5 चीजें चंगियां मियारी ते सस्तियां ते नाले ऑफर ही ऑफर
और क्या
ताजा गोश्त ताजी सब्जियां ते फ्रूट आटा चावल दालां मसाले ते जूस सारे बिल जमा करने गैस ते इलेक्ट्रिक ने टॉप अप भी करने पाकिस्तान पैसे बिल्कुल फ्री भेजने मतलब के एक चिड़ी ने दूध छड़ी ता हर शय लबनी
और जने ने आप उतरा
Amar Food Store and Halal Meat 613B Lincoln Road Peterborough telephone 01733 687374.
My name is Khalid Siddiq.
I'm Saif Adam.
Salaam alaikum, this is Baraka Blue.
Yo, this is your boy Harris J, and make sure you guys stay tuned to Salaam Radio 106.2 FM.
Salaam Radio, in conjunction with the Council of British Hajis, presents a Hajj seminar Sunday the 21st of July from 1 p.m. at the Allama Iqbal Centre, 157 Cromwell Road, PE1 2EL. Multimedia guide presented in English by Sheikh Suleiman Ghani and Abdul Akbar. Learn how to perform Umrah and Hajj. Practical guide. Interactive Q&A. Health and safety advice. Hajj travel shop. To book your tickets, visit cbhuk.org/events or call 0845 833 4145. Hajj Seminar, Sunday the 21st of July from 1 p.m. at the Allama Iqbal Centre, 157 Cromwell Road, PE1 2EL.
Do you own a restaurant or takeaway? F.R.C.R is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices. Or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
Let's get back to Islam before the sun goes down. We never know when we'll be under the mount. I'll pray when I get older, that's what they say. But we might not have even one more day. Let's get back to Islam before it's too late. Oh man, can't I just delay it for another date? Time's running out, our lives are almost done. But brother, I'm too busy having fun. Let's get back to Islam. Jahannam ain't funny. Come on man, I'm too busy making money. The Quran sits on our shelves and there picks up dust. The longer we stay away from it, the more our hearts pick up rust. Let's get back to Islam before our lives are gone. Not right now, I'm too busy. Can't you see I have the TV on? There's no time to wait, let's start it now. Come on, for Allah, can't you even bow? Let's get back to Islam, this ain't just a song. But brother, a few minutes in prayer, that's too long. I'll go on Hajj when I'm around 55. Come on man, by then will you even be alive?
Broadcasting 24 hours a day, 365 days a year. This is Salaam Radio.
Assalamu alaikum, welcome back. This is Dr. Shabina Asad Qayyum for the Body Health and Mind Show on Salaam Radio 106.2 FM, Peterborough's only Muslim community radio station, broadcasted on 106.2 FM and online. I remember that off by heart. I listen to Salaam Radio when I'm going into work in the morning, when I'm dropping the kids off to school, on the way over here. It's always on, mashallah. So it's absolutely a delight to be here. Now, before the break, we had the wonderful Dr. Mohammed Ahsan Saleem, who is a consultant radiologist in breast and clinical radiology at the University Hospital of North Tees and Hartlepool. And we were talking a little bit about breast screening, the difference between an X-ray, a mammogram and an ultrasound, why a mammogram is implemented, what ages it's implemented. We were most recently spoke about what signs and symptoms to look out of in breast cancer just before the break. And Dr. Saleem, I hope you're not getting bored and you are here with us.
No, yes, I am.
Mashallah, that's really good. So, following on from what we were speaking about before the break, Dr. Saleem, would you like to talk a little bit about, I'm going right back now, to talk about a little bit about the risk factors to developing breast cancer?
So the risk factors, the way we divide them is there are certain risk factors which can be changed, and there's certain which are fixed, so which can't be changed. The ones which cannot be changed is most of the breast cancer we see, probably more than 70-80% is in ladies who are above 50.
Okay.
So that's a risk factor. Age is a risk factor, and certain age groups is more common. So that's why we start screening at 47 and 50 years of age.
Right.
Then family history is another important factor. The genetic factor, the gene called BRCA1, B-R-C-A1 and B-R-C-A2, which is again a very high risk. And if we have any ladies or any ladies of younger age group in their 20s and 30s, if they get diagnosed with breast cancer, then we do refer them to genetics and their whole family, immediate sisters or mothers, relatives are advised to get their genetic testing done. So that's an important factor. And further factors which we obviously breast cancer develops in the ducts of the breast because your breast is composed of glands and fatty tissue, and mostly develops in the glands. So denser the breast glands, the higher the risk of the breast cancer.
Right.
So that's another. And then other conditions obviously are like if the patient had a previous cancer, especially breast cancer in one breast, they are more likely to get the cancer in the other breast as well. And then again, age at which period started and the period stopped, and then if the female didn't have any children in their childbearing age, then that increases the risk as well.
Okay.
The risks which can be altered again, which is probably similar for other cancers as well. Being an overweight and obese increases your chances of having a breast cancer, like any other disease or any other cancer as well. Smoking and alcohol is another thing which increases your chances of having a breast cancer. So those are the main things which you need to be aware of. So if you are smoking, to cut down, you need to again alcohol, and then again sedentary lifestyle is another thing which increases the chances of breast cancer.
Sure.
So those are the main ones which we need to do. The only other thing is if someone had a different type of cancer in their childhood and they have received radiotherapy to their chest wall, then that increases their risk as well. But again, that's a factor which cannot be altered. If someone already had it, cannot be changed.
Sure. And in terms of radiotherapy. Are we? When some people undergo CT scans, for example, it's a question that I was actually sent before the show. That having CT scans and multiple X-rays, especially of the chest, are they also a risk factor to breast cancer? And this was actually asked by a listener of the show.
Yes. So yes, yes, it is. But again, there are what we call the certain medical imaging regulations, which we call regulations. Now, obviously, if patient is a known case of cancer, and then obviously you can't take the radiation away. You need to have progress, and you have to give them the radiations to look for the images, to follow up the disease. However, if a patient who is being healthy, well, then we tend to avoid radiations. Having a one X-ray is not going to change or increase the risk of having cancer. However, as you said, serial X-rays, serial CTs, that does increase the chances. And that's why in UK at least we are very strict, especially when it comes to children. We tend to avoid CT unless it's critically indicated in conditions of trauma or life-threatening injuries. We tend not to use the CTs, and in children we go for MRI because MRI does use radiation. That's the magnetic imaging. So the chances or the risks of developing cancer are much lower compared to CT.
Okay.
So those are different.
Okay. I have another question. He's just come in on my personal inbox. That does CT scan radiation increase the risk of breast cancer or which type of cancers?
So again, as I said, if it's a one-off CT, for some reason it won't. But again, it depends if it's a serial CT you're having for multiple for some other conditions. Yes, it does increase the risk of having cancer. But again, it's not solely the reason for having that cancer. It's only certain by certain. I would say time probably 1 to 2 times more risk of developing breast cancer. And again, it depends on the type of breast tissue. If you have a more glandular breast tissue, then the radiation may have more effect. If it's a more fatty breast tissue, then the effect of radiation won't be as severe as the breast tissue.
Okay.
So the answer does increase, but it won't be solely responsible for cancer.
Okay. I hope that's answered the question of the listener who's asked that. They'd like to remain anonymous, which is absolutely fine. Now, I've got some statistics over here that I'd like to share with you, Dr. Saleem, and obviously you will know of them anyway, but there is current evidence, and this is something that I'd like my listeners to be aware of, which is why it's so important to assert on screening, that there is current evidence that suggests that breast screening reduces the number of deaths from breast cancer by about 1,300 a year in the UK. And breast cancers found by screening are generally to be at an early age, like you said, and early stage breast cancers are more likely to be cured and may need less treatment, and also that 99% of women who are diagnosed with breast cancer at the earlier stage 1, survive their cancer for 5 years or more. So that's 99%, which shows, doesn't it, how effective this is?
It is indeed. As said, earlier we catch it, the better it is. Because the way the breast cancer develops, it develops in the ducts. Now, from the ducts can spread into the blood vessels and into the lymph glands in your armpits or axilla. And then the more it spreads, the more difficult it becomes to treat. The smaller the cancer, and you catch it early, then you in terms of the treatment as well. But in terms of only a bigger surgery, if it's small, it can be treated on that day, and you go home, and you don't have to stay in the hospital. It's only for the advanced cancer where you need a slightly bigger surgery, and sometimes you have to remove the whole of the breast, called mastectomy. However, if it's a smaller cancer, what we call is local excision. We just localize that cancer with the help of a wire. Nowadays we use radioactive seeds, and the surgeon just go around that cancer and take a bit of healthy tissue, about 1 to 2 millimeter tissue around that cancer, and that's all done. And then again, depending on what pathologists tell us about the nature of the cancer, we can treat it with chemotherapy if required.
Wow. So is this a procedure that you perform yourself, or do you do this in conjunction with the breast surgeon?
So localization of the lesions we do ourselves. and then afterwards, and then the treatment is done by the surgeon.
Okay, I see. Now, so that we can be completely clear with a patient's journey into hospital. So, say we have a middle-aged, well, not really middle-aged, but 50-year-old female, first time she's going in for her breast screening appointment. Would you like to make our listeners aware of what they could expect on the day of the appointment, what takes place, and talk them through that journey, please?
Yeah. So obviously, what happens if someone turns 50? They will have a screening mammogram. And that mammogram again will come to the hospital where we'll read it on the computers. And if we have any suspicious features, then we will call that lady to come to the screening clinic. Once she comes to the clinic on the day, she will meet one of the breast care nurses just to introduce themselves, because the breast care nurses will be their first point of contact, and they can contact them anytime on the phone and discuss stuff which they want to discuss. Sure. Once they are in the screening clinic, we may not have to do further mammographic views, which we may not do. And then when she comes to the clinic, what we call triple assessment. So we're going to examine the patient to make sure we don't feel any lumps in that lady, and then we'll do the ultrasound scan. Again, depends on ultrasound scan. If it shows us a or any abnormality, we may proceed by taking a sample biopsy on the day. Right. Now, the way we do biopsy is obviously we try to be clean procedure. So we clean the skin, we give local anesthetic to numb that area so patient doesn't feel any pain. However, if certain times it can happen that we see abnormality in the mammogram, it's difficult to see on the ultrasound. Then we can do the biopsy on the mammogram. So we have both facilities to do biopsy on the mammogram or on the ultrasound. And in my practice and general other consultants do as well. Every time a patient comes and we are suspicious of a cancer, we examine their axilla, and we do ultrasound of the axilla as well, just to make sure there are no abnormal implants in the axilla. So that's a whole set of what she has. And then if we have taken a biopsy, then we'll give a patient to appointment to come back to the clinic to see a surgeon in 7 to 10 days time. By that time, they'll have pathology results ready. And also we would have discussed that in the multidisciplinary team meeting. So we would have a whole plan of treatment ready as well. So on the day patient comes, discuss everything.
Okay, wow, that's amazing. Now, just going back to what you mentioned about any glands in the axilla, which is the armpit, in layman's term, if you were to find a gland, do you localize that and take a biopsy of the gland as well in the same sitting?
Yes, we do. So there are certain parameters which we use that classify glands as either they are normal, abnormal, or they are borderline. Okay. So if it's a borderline or if it's abnormal, then we do take a sample just to make sure because if the lymph glands are involved, then we might have to change our treatment plans differently. However, if they are normal, then it's different. It's slightly less treatment. So that makes a difference. And then again, helps surgeons their surgery according if the glands are abnormal, the plan to take them out during surgery. However, if they are not abnormal, then they will not grow that way. And again, when we do ultrasound, surgeons during surgery, they also look at the glands just to make sure there are no abnormal glands as well.
Okay.
With new treatments coming up, there are certain drugs to help which we can give chemotherapy drugs which can help decreasing the size and the abnormality in the glands as well. So we can do at the same time.
Okay. I have a question here from a sister Adila on my personal inbox who asks me, dear doctor, thank you very much for a wonderful informative show. Could you please let us know, is local anesthetic enough when you have invasive procedures? Does that not give pain?
So Again, the
Again,
pain
the
perception
pain perception
is different from patient to patient.
to patient.
Some patients, need
need
more anesthetic,
more
some
anesthetic,
need
some
less.
need less.
And it's
And
just an
it's just an
example. If you've
example.
been to
If you've been
dentist,
to dentist,
you
you
get a local
do get a
anesthetic.
local anesthetic.
Taking a
Taking a
biopsy, it's
biopsy,
kind of
it's
similar
kind of similar procedure
where you give
where
local
you give local
anesthetic.
anesthetic.
So the way
So
again
the
we
way
do
again
it,
we do
we
it,
numb
we
the skin
numb the
area
skin
first,
area first,
and then we
and then we
localize
localize
usually
usually with the
ultrasound, and then
ultrasound, and then
target
and give
local anesthetic
local
around that
anesthetic around
lesion
that
just to
lesion
make
just
sure.
to make sure.
However,
However,
if during the procedure patient still feels the pain, then we can always give them more
give
local
them more
anesthetic.
local anesthetic.
So,
So
and it's quite
it's quite
adequate,
adequate.
the amount we
The
give.
amount we
A
give.
lot of
A lot of
patients
patients
do not feel
do
any
not
pain.
feel any pain.
They do feel
They
a
do
bit
feel
of pressure,
bit of pressure,
but they won't
but they
feel any
won't feel
sharp,
any sharp,
stingy pain.
stingy pain.
Right, okay. I hope
Yeah.
that's answered the question, sister. The next thing I guess I would like to ask, because there are always benefits of screening, there will always be, but are there any? It's hard to use the word harm, because harm isn't what we advocate in the NHS or in the healthcare profession, but are there any disadvantages to screening? For example, we have pros and cons. Are there any cons to screening, breast screening per se?
Not that I can think of,
to be honest.
As I said, it's a program which is started in UK, designed for ladies. It has significantly reduced the mortality and morbidity associated with the breast cancer. As you mentioned, the 99% of women have a 5-year survival rate. So overall, it helps. I think. And then. Yes, sometimes again, every patient has different the way they react to the disease or illness. And a lot of ladies who come to the clinic when we call them, and again, it's another important point to keep in mind. Any lady who has a mammogram for the first time, it's likely to be called more frequently to the clinic because we don't have previous films or imaging to compare with. Sometimes we call them, and it turns out it was a benign cyst. And cyst is a simple cyst, benign cyst has no association with the cancer. However, at times it's difficult to differentiate between cyst and a malignant or a cancer on the plain mammogram. So that's why we call the patients back. And when the ultrasound is assessed, we aspirate, it goes away, and patient can go home. So as per se, I don't think there's any harmful effects of the screening. I think it's quite useful, and people should attend free of cost. It helps, and it's not only for you, because obviously there are the people associated with you. So it's a whole wider community that gets affected.
Of course, and very important and very useful information that was being given there. Now, Dr. Saleem, I have another question over here. Again, the sister chooses to remain anonymous, which is fine. And she asks us that, thank you very much for this very important making us realise of the awareness. Dr. Saleem, please could I ask, you did say that often a patient is diagnosed and possibly treated on the same day. However, if it is a much bigger cancer, how often will she be seen by a specialist?
So again, in terms, I think might have been relayed properly. So the day we see the patient, we do the biopsy. Obviously, we don't treat the patient that day. We need to get back the results of the biopsy. And once the biopsy comes back, and if it's a small cancer, it gets treated in a day. So the patient comes in the morning and goes home. So obviously we need to have pathology results. However, if it's a big cancer where the patient needs more treatment like a mastectomy or bigger surgery, then they can stay in hospital for a day or two, and they can have subsequent surgeries. So obviously a patient who has mastectomy, then you need to consider about the cosmetic surgery as well, which is again done by the plastic or oncoplastic breast surgeons, which are highly trained surgeons, and can help you in dealing with these situations. So again, you may need one or two, sometimes very rarely a third surgery as well. So it's but again, we have seen cases where patients have mastectomies and done a wonderful recovery, and they went back to their normal lives, living like a normal person as before the cancer. So
absolutely. Yeah. It's very important to make people aware of that realistic element as well.
Yeah. And the other thing is obviously with surgery, you may or may not need chemotherapy or radiotherapy. Again, it depends on the type of cancer. But again, those chemotherapy and radiotherapy nowadays are very well advanced. You go to the hospital on the day of your appointment. It probably take an hour, sometimes 4 hours to stay, and you come back. You don't have to stay in the hospital for having a chemotherapy.
Right. Okay. So that, again, that was something to be very wary about, listeners, is that for chemotherapy treatments, you sometimes just stay in for a day or so. And it's usually just the side effects, but you are monitored more or less because of that. Now, in the last couple of minutes, Dr. Saleem, would you like to reiterate any main points that you would like to give in the way of messages to the community about the importance of screening, why it needs to be done, what to expect, etc.?
So again, as started, that one in eight women will have breast cancer in any age of their life. Premenopausal ladies who obviously don't come for screening. If you feel any lumps or any concerning symptoms, you can go to your GP and they can refer you to breast surgeon or breast radiologist, and you can do the further scanning, imaging just to diagnose. Not all the lumps are cancerous. Yes, we know that with looking at social media and media, we read all about it. That any breast lump is cancer. Not all the lumps are cancer. There are certain benign lumps which are fibroadenomas, benign simple cyst, hamartomas, which are simple benign lumps which can be left alone. Don't have to take it out, and there are cosmetic reasons. In terms of screening, ladies, again, 50 to 70, but now 47 to 73 gets a call every 3 years. However, between those 3 years, again, if you feel any lumps, any change, be it within a one month screening mammogram, you should go to your GP and get it checked. Because the help is available. You get seen by a doctor, you're seen by a radiologist, and then last but not the most important is you get your peace of mind. If there's something you felt at least you can relax. Anxiety goes away. And the way clinics work, screening comes, patient comes to our clinic, do a biopsy. You tell them that the biopsy results will take about a week, 10 days. In that time, we do have results. We discuss them with the oncologist, cancer specialist, pathologist, surgeon, breast care nurses, and formulate a plan. And then again, on the next appointment, we discuss everything with the patient. Okay. And as obviously you mentioned as well, mortality and morbidity is significantly after screening. So ladies should take. And what we have done is one of the mammographers, which again she is a lady from Pakistan, but she is working with mammogram. She does these workshops where she goes into the community and she does all those workshops. So I think that's something else that we can do at local levels as well. So a local mosque where the ladies section. So any doctor, any health professional can go and raise awareness, and that will probably may help the uptake of training program.
And I think that's very important because recently, in the last couple of months, we had the screening importance for bowel screening, breast cancer screening, and cervical screening on behalf of the British Islamic Medical Association. And we had such a large turnout that it was wonderful. And we've got another question over here from a sister who states that my mother has come over from Pakistan. She is going to be residing here with us permanently and now is registered with the NHS. She is 53 years old. How do I get her to have her breast screening initiated? I think that's a very important question.
It is indeed. I think what you can do is you can either ask your GP or you can which is your local hospital, because there are certain hospitals which do screening. Not every hospital in the region does it. So if you go and ask your GP, and they will give you the details, and GP can refer your mother, or her GP can refer her to the screening hospital, and she'll get an appointment. So or they can directly call the breast unit in the hospital, and they must have give them the details. They will certainly book an appointment for her.
Okay. I hope that has answered your question, sister. Got another question just before we wrap up, and the sister over here says, wonderful show. Thank you very much for these informative shows. Sister Shabina, I recall you giving a talk on menopause at one of the mosques here in Peterborough. I would like to say that you did give us some information about a slight increased risk of breast cancer developing with taking HRT that has estrogen in it after the age of 51 or menopause. And yes, you're absolutely right. There's only a very slight increased risk of developing breast cancer on HRT, isn't there?
Yes, there is.
And
we have your breast has
eastern receptors.
So there are certain types of breast cancer which we call ER positive. Estrogen receptor positive breast cancer. It does certainly increase your risk, not a lot, but a certain small degree. There is increased risk after 50.
Okay.
Yeah, after menopause.
So I hope that, thank you very much for that, sister, for bringing that very important point forward. And Dr. Saleem, what can I say? The time has run out again, but we will, inshallah, have you. And I hope you have enjoyed our time.
No, thank you. Thanks for having me. It was lovely talking to you as well.
It really was. Yes, we've got to catch up over here on Salaam Radio rather than
definitely
casually, inshallah. And please give my love to the children and Salaam to everybody else at home. And thank you very much on behalf of Salaam Radio for giving us time today, your valuable time.
Thank you
very much. Assalamu alaikum. Assalamu alaikum. So that was Dr. Ahsan Saleem of the NHS, and he is a consultant in radiology, clinical radiology at the University Hospital of North Tees in Hartlepool. So he gave us a wonderful talk on breast cancer screening. And now I've got an absolutely enormous poster over here that I want to make you aware of, and this is about the Sultan and the Saint, a commemoration of 800th anniversary of St. Francis braving enemy lines to meet with the Sultan, and it's an event. It's going to be taking on Sunday 14th of July at 3 p.m. It's a film at the John Clare Theatre. Admission is free, ticket only, available at the Visitor Info Centre. And the one that's important that I want to bring to your attention is the 2019 Hajj Seminar, which is a practical Hajj guide with multimedia by Sheikh Suleiman Ghani and Abdul Akbar. Book it online, please. It's on Sunday, the 21st of July 2019 from 1 to 5 p.m. at the Allama Iqbal Centre. And the booking details are at www.cbhuk.org/events or call 0845 833 4145. Once again, thank you very much, and inshallah join us next week for an informative packed show with your very own Dr. Shabina Asad Kiyum. Assalamu alaikum.
Stay tuned to Salaam Radio after